Good evening. Thank you very much for joining us here on Urban Debate on Mirror Now. I am Heena Gambhir. Viewers, India in the last 24 hours has reported 2,47,417 new coronavirus infections. Now, this is the highest that we have seen during the third wave so far. Daily positivity rate has jumped from 11.5% yesterday to 13.11% today. Just see how the graph is going up. And there has also been a sharp increase in the use of readily available home test kits. Therefore, non-reporting of positive COVID results via rapid antigen kits and home test kits has become a huge cause of concern as the authorities are unable to track, isolate and treat those who are testing positive using these home COVID test kits. Now, experts feel that this means that actual number of people testing positive for coronavirus could be much higher than what is being reported. Now, as per the data by Ministry of Health, on 31st of December, 2,424 home testing kits were used in the country. And this number, in fact, has gone up sharply to 10,995 on 12th of January. Maharashtra government has asked the district and civic corporations to monitor the sale of at-home testing kits and ensure that people using them report the test results to the authorities as well. So on Urban Debate tonight, we will try to understand from our panel of experts whether these home test kits are reliable or they are risky. How and when should they be used in case somebody is planning to use them? And joining us this evening to answer these very, very crucial questions are my guests. We have Dr. Sanjeev Bagai, Chairman Nephron, joining us live. Dr. Ankita Badia, Infectious Disease Specialist, Manipal Hospital, will be joining us in just a bit from now. Dr. Arjun Dasgupta, Founder Member, WBDF, is live with us this evening. And Dr. Rajiv Dasgupta, Chairperson, Center of Social Medicine, Community Health, JNU, and member of National COVID Task Force, also joining us on the broadcast this evening. Thank you very much, all of you, for joining us here on Urban Debate on Mirror Now. Firstly, I want to ask you, Dr. Bagai, why do you think this spike in use of home testing kits is becoming a big cause of concern, for almost all the states, especially in the third wave?
Good evening, everyone. So I think rapid antigen test, which is being used as a home kit, is an extremely useful tool in our armory. The important distinction between this and RT-PCR is this is for a wide-based screening, whereas RT-PCR is more diagnostic in nature. We have a lot of percentages and other statistics with the rapid antigen test, but it's highly heat sensitive. It's done at home, so it's operator dependent. The tracking of this is important because a lot of the tests are going hugely unmonitored, so you really don't know what the case positivity is. And last, most importantly, is that where you're buying it from is also not being known. So I think we need to know who's bought it, how many kits are being bought, how many are being positive, so that those patients can be tracked. The sensitivity and specificity is pretty good with this, especially the lateral flow, and now the quantum test is pretty good. The specificity is more than sensitivity, but the two key points to keep in mind is that if the temperature goes high in the environment in which it is stored, then it loses its sensitivity. And if it is too cold in a temperature, it loses its specificity. There is a randomized meta-analysis which has been done of more than 14,000 articles of 214 databases, more than 1.5 lakh patient samples, which has shown a very, very good sensitivity and specificity overall. And the last important point I wish to make is that this test is your CT value dependent. So if your viral load is high, that means your CT value is low in the nasal passage, your sensitivity is higher. So if your CT value is less than 20, it gives you a sensitivity of more than 96%. Whereas if your viral load is low, say more than 30, your sensitivity can drop down to a mere 20%. Your picking up is important. So if you do it in the first week, you get a higher sensitivity. If you do it in the second week, your sensitivity goes down. So timing, storage, procedural issues, more important from tracking the data is critical.
So you're of the view that using it, even if somebody wants to, then during the first week is better. That is when it will give better results.
It is used, the pickup
Okay.
of it is best, infectious load is high. So if it is used early, your diagnostic
Okay.
accuracy is much higher. If you do it after day 3, day 4, or definitely after a week, your sensitivity is lost almost dramatically.
Okay. Dr. Rajiv Dasgupta, I want to understand from you, in your opinion, how reliable are these home COVID tests that are being used? We've not seen them being used in this large number, at least during the second wave. Maybe it wasn't available so easily. What is your view on this, sir? Is it reliable or risky?
Thank you. No, it's certainly reliable. And as Dr. Bagai very eloquently explained, this is very relevant and useful at this point. The use of or the relevance of these home test kits goes up if the overall incidence is very high, which is exactly the phase which the country is passing through, or certainly most of our larger towns and urban areas are passing through. But the important point is that these need to be actually deployed more for institutional settings where you have workplaces, particularly for essential services, where we have to maintain a certain pool of active workers. These are very relevant for student hostels, residences where security forces are housed. So rapid testing actually helps to check if someone has COVID-19, and if they test positive and self-isolate, it helps stop the spread of the virus. And the biggest challenge, as we know at this point, is to maintain adequate human resources for all our essential services. And therefore, these have to be deployed more effectively, more intelligently. These have to be backed by appropriate communication messages so that we can get the best out of it, epidemiologically speaking, from a public health perspective. So there's an individual perspective of one trying to find out whether he or she is positive after getting exposed, or if you are visiting your elderly relative, whether you are positive and you don't want to expose him or her. And at another level, there's a larger public good in deploying this in a very careful, calibrated manner. So as of the 6th of January 22, the ICMR has tested 12 rapid antigen-based home or self-test kits, validated them, found them to be satisfactory. These names are uploaded on the website, and if anyone is purchasing these off the counter, can actually check whether it's in the approved list or not.
Okay, that's very interesting that now it's getting an approval from the ICMR as well, and you and Dr. Bagai believes that it is the right thing to do at this point in time, and we all know this will help people find out whether they are COVID positive or not. But Dr. Ankita, my concern is that there are many who might be using these home test kits and maybe not informing the authorities. What is, do you see that as a big concern? Because going by the kind of reports that we are getting, for example, from Maharashtra and other states, which seem to suggest that the home testing which is happening is not being reported. So maybe that's the reason why in the last few days we saw a dip in Maharashtra's numbers too, the COVID numbers. So do you believe that is a concern?
So, Heena, if we see the positive aspect, it gives early diagnosis at home. The patient can know whether he's positive. If he's having symptoms, and RT-PCR can have a delayed result, maybe a day it can take in the current scenario. But the negative aspect of this that has to be addressed very well, that there is right now no reporting system for this self-testing kit. So the numbers that are being sold from the chemist, the numbers that are being tested, and how there is no reporting system. Like if a person take the test kit at home, tested himself, and he is positive. Now there is no reporting system. If he has mild symptoms, this numbers goes out missing from the national data, and this is a concern in the way when we are seeing the actual results, the patients with symptoms and the patients reflecting the data is different. That overall the status that comes in the mind of the government related to any whether we are going to for a lockdown status or the management at the administration level might differ. So if the numbers are huge, but the numbers that are reported are not matching to that, and the patients land up for the hospitalization, so our healthcare system might not be appropriately prepared for that. So that is a concern. There has to be a system in place, maybe some app based, that somebody who is testing, just like a COVID portal that was developed and is very successfully maintained and is working for the vaccination. Maybe this is now the requirement of time, a self-testing kit, because the numbers are very huge. This Omicron is a very infectious strain. But if we see these numbers goes missing from the national data net, that makes me little skeptical that are we dealing with this with the system right now that is actually having the correct data, for which we are talking about positivity rate. We are talking about that whether we are having control over this reporting system for the RT-PCR, based on RT-PCR, that yes, that is there. There is a reporting system related to which type of sequence, based on sequencing, whether we are dealing with Omicron or Delta, but this is still missing. It's a good thing that we have this available in the market, but yes, a reporting system for the national authorities has to be there, because it's a pandemic that is being dealt globally.
Let me quickly add.
Interesting. Now, Dr. Arjun Das Gupta, are you concerned? Yes. Yes, Dr. Rajiv. Yes.
Sorry. On 19th May last year, in its advisory that the ICMR uploaded, it said very clearly that the app is available in Google Play Store and the App Store, and the idea was to link each of these kits through that app. Now, in the UK, for example, NHS operates a single portal. Now, this is something which is not happening, and the apprehensions expressed are quite right. And that's why I said that it ought to have been backed by appropriate communication messages. Thanks.
Okay, so the app is available. The procedure is there that needs to be followed by someone who is using these home kits for testing, but it's not being used, and that's clearly a cause of concern. Dr. Arjun Das Gupta, what is your opinion on the rampant use of home kits that we are seeing in the third wave specifically? Do you see it as a reliable way to diagnose COVID early, or do you think eventually it is RT-PCR test that should be done? Because here we're talking about another variant of concern altogether. And this test, the home kit that we use, the result does not tell us whether the person is infected by Delta variant or Omicron variant.
I think it's brilliant. I think this is absolutely suited for the time frame that we are in. We are in a community phase of this spread of these viruses. There is absolutely a tsunami of cases swarming among all the important cities and the countryside as well. So the whole power of making the decision making and the diagnosis is giving away from the medical establishment to the common people should be welcomed. I mean, it's a cheap test, it's a fast test, and it gives you a result straight on to tell you whether you are positive or a negative. Now, to the reporting bit, yes, the government needs to step in, stop scaring people that have this and tell them that this is nothing. There should be, I agree with Dr. Rajiv Das Gupta and say there should be a single portal, a single app from the government where there should be a reporting. Otherwise, this 250 rupees or something like that test, there is an absolute anarchy going on with RT-PCR. There is not enough time frame. There is a 48 hours delay with reporting. It's a hugely expensive, and very few centers can do it. We knew that the ICMR took months and months to give proper recognition to the laboratories which had capabilities to do RT-PCR, but wasn't given the necessary permission. So this is the democratic process. People just go there in the corner shop and buy it and test it. Now we have seen from the Ministry of Health and Family Welfare and ICMR guidelines that we have shifted from the basic test and isolate principle. This is now the principle is basically to stop the number of hospitalization. For that, the RAT test is perfect. The UK is using it for day 6 and 7 for the healthcare workers to let them join back to work. We should welcome it, but we should simplify the process of reporting so we get the number of infected persons in and give us some idea of what's going to hit us in the next few days, whether the number of hospitalization is going to go up or it is going to go down or is going to stabilize. We need to know that. Otherwise, people have really caught on to it compared to the wave now, first wave and second wave. In the third wave, people are testing the rapid test right, left, and center, and they will probably do so more in the future. So if the reporting is simplified, I don't see a problem with it. I think this should be welcome.
Okay, but how can we simplify the reporting process, Dr. Bagai? I want to ask you that question because Dr. Rajiv Das Gupta told us that there is a process in place, but it's not being followed properly. So what can really be done? What is important? What is needed to simplify it, in your opinion? When somebody buys a home test kit, what should be done? What is supposed to be done?
That's the core issue. So I think we need to address the following key points. One is to remove the stigma in people's mind that if you have Omicron or if you're COVID positive, it's a disaster. I think we need to remove that fear. We need to remove the stigma, having posters plastered across your gate or your entrance of your house. All that drama really is now passing. All that has to stop. We cannot scare people, otherwise people will not come out and actually declare themselves as positive. Point number two is there has to be a mechanism, because it's a self-done test. There has to be a mechanism of tracking the number of tests sold, to who it is sold, and the reporting. Now, reporting in a home test is always extremely difficult. One is a huge honesty factor, and the second is manpower and tracking who's going to actually give this data in and how this data is going to accumulate. But having said that, I think there has to be a system in place so that we can catch them and catch them early. Now, the usefulness of this, Heena, of this RAT, what we call as rapid antigen test, is that your RT-PCR, which has a maximum sensitivity between 67 and 83%, actually focuses on your spike protein, where your two main antigen sites are being isolated and picked up. The advantage with RAT, rapid antigen test, is it focuses on your N-terminal domain, which is not being hampered by your S failure gene. So it is important to give this a good chance, a good bet. You can have this picked up about 1.5 days earlier than RT-PCR. So your diagnosis is a little earlier when the person is at the infectious most. Why do we want to check a person at the infectious most? Now, we know worldwide data, 35 to 38% of people globally are asymptomatic carriers or polysymptomatic carriers. Even more surprisingly, children are 49.5% asymptomatic carriers. Now, if a person doesn't know that the person is having it, or he has a very mild symptom and is neglecting it, he can meet hundreds and thousands of people in a week or 10 days' time, and this is now into the community. So you need to identify and track and diagnose a person early at the infectious most. Early isolation is the only way in which you can contain the spread of a highly contagious microaerosol airborne variant.
Okay, so definitely it's something that is needed to diagnose it quickly, and you've said it very correctly, Dr. Bagai, that we also need to now remove the stigma that's associated with somebody testing positive for COVID. Maybe that's the reason why many who are using these home kits who eventually come out as positive are not reporting it as well. Now, Dr. Rajiv Das Gupta, shifting our focus now to the issue of testing. In the third wave specifically, I was just looking at some data. So on 2nd of June, India tested about 37 lakh samples. Around that time, 36, 35 lakh samples per day were being tested. That's as per the ICMR data. Now, 12th of January, 18 lakh tests happened, when our capacity, of course, is much higher. Is this only because of rampant use of home kits, or there's some other reason?
No, let's look at this differently. these two variants, Delta, a Delta-led surge and an Omicron-led surge, which we are now passing through, these are quite distinct. In fact, it's a completely new elephant in the room. So the testing is also altered accordingly. Far more people were symptomatic there, and therefore testing was much higher, whether it's rapid antigen tests at a more community level, or say in transport hubs and so on and so forth, plus clinically tested in the lab with RT-PCRs. Now, here in Omicron, we have a situation where 1 in 3 are asymptomatic, most have a very mild disease, and therefore the intent to test is actually very low, and people will think that it'll just pass off. And therefore, to extend the argument that Dr. Bhaggai very rightly said, if it was test, now in addition, we should have communicate. Communication is going to be very, very crucial in how we handle Omicron. Now, if we see the South African situation, now South Africa is just about the size of Karnataka in terms of population. Now, South Africa was testing roughly, this is the fourth week of December, which was their highest period of incidence. They were testing about 500 samples per 100,000 population. That would translate in Indian population terms to about a level which is more or less consistent with 18 lakhs, because you can't directly extrapolate it to the country because different states are in different phases. So in terms of totals, we are actually not doing badly. I think where we are not really living up to the standard is perhaps we are not detecting enough. At that time, they had a weekly test positivity rate of 35%, which is something which you are beginning to see in South Bengal, for example. So probably in a week or two, it would come to resemble those levels. We are not doing badly, but perhaps we need to test more.
We need to test more. So in a way, Dr. Rajiv Dasgupta, you agree that, in some way or the other, the rampant use of home kits could be a reason behind, one, the low testing rate and the low detection that's happening, or underreporting of numbers, can we say?
See, home test not backed by a reporting system is going to lead to so-called underreporting. But there's another catch. The fact that I test at home, I test positive, and if I feel all right, I may go back to my workplace tomorrow. It doesn't really serve the purpose. Therefore, risk communication becomes extremely crucial.
No, but if you test positive, then shouldn't you be reporting that to the authorities? Shouldn't the authorities know that, somebody has tested positive, and hence that person might be asymptomatic, but the people who came in contact with that person, maybe they need some kind of attention? Isn't that then defeating our strategy of testing, tracking, and isolating?
We are saying the same thing. So home testing without a reporting system loses its relevance or teeth. But over and above, even if I test at home, and that's what's happening in many cases, I test positive, yet if I'm clinically feeling all right in a day or two, I'm going back to work or I'm mixing with people, that doesn't help limit the spread. And therefore, that's where the risk communication comes in. And that really is defeating the purpose of a very rapid spread or limiting the rate of spread. And those are loose ends which need to be tied up.
Heena, can I make a point?
Okay, Dr. Bhaggai wants to come in, then Dr. Ankita.
Yeah, so there is a very beautiful detailed study from Japan which has shown with regards why it is important to pick it up early and what should be the duration of isolation as far as so-called quarantine is concerned. So a person is at the infectious most. That means you peak in your viral RNA in your nasal area between day 3 and day 6. But you are still harboring the virus between day 6 and day 10. There is no active virus of Omicron after day 10. What will happen if there is inaccurate self-reporting or indeed hiding, a person will stay in isolation for a couple of days till the so-called little upper respiratory symptoms settle down and the fever settles down, and then will be all over town. The important point here is if you do not keep a person isolated, at least for 8 to 10 days, you are still allowing the spread to occur. That will defeat the entire game plan at the present moment. So we need a system in which there has to be some amount of course, a moral integrity in which you report. It's very much like a pregnancy test. Who are you going to say that this test is positive or negative? So there has to be a system to monitor, to track, to isolate. The two important points in Omicron management going forward, rather three. One would be a public communication along the lines of adequate type of mask, the type of reporting of Omicron, remove the stigma. The second important point for managing Omicron is ventilation policies. And third most important is if you do not isolate, you miss the game.
Absolutely, and that is the reason why it's very, very important we get to know whoever is testing positive using these home test kits. We have some viewers as well joining us on the broadcast because the numbers are flashing at the bottom of your screens, and we are asking our viewers to call us in case they have any concerns or questions regarding the use of home test kits. We have Jason Fernandez joining us from Mumbai this evening. Jason, good evening. Thank you for speaking with us here on Mirror Now. What is it that you want to say, or if you have any questions, please go ahead.
Yes. Good evening to the panelists. Hello.
Hello.
Yeah.
Good evening. Go ahead.
I wanted to ask the panelists that people who are doing the home testing, are still moving out even though they know they are positive, and there are millions of people getting affected by them. I myself had contracted COVID recently, and this was because someone tested positive but didn't report. And I have multiple other illnesses like COPD, and this was a problem which made my COVID very bad.
Well, that's a very important concern that you've raised, Jason Fernandez, and something that we also wanted to highlight with our panel of experts today. We'll get this answered. Let's take another question from another viewer joining us, Adil from Navi Mumbai. Good evening, Adil. What is your question?
Hi, my question to the panelists is there are two kind of variants which are discussions which are happening right now. One is the WHO is saying that we should be taking this variant very seriously, and the local experts, the Indian experts from multiple agencies are talking about saying that no, this is just kind of a flu. So this is my first question. Second question is, I was affected in September 2020 with COVID, and I was in the quarantine period of 15 days. Now again this year, last Sunday, I've been tested positive. So when and how should I test myself again to be sure that I'm not COVID positive, and how seriously we should take this and educate people that is it serious or not serious, because I'm completely confused, and I hope there are others also.
Okay. Yes, that's an important point that you've raised. Adil, appreciate you joining us here on Mirror Now. We'll, of course, get this answered. Dr. Ankita, will you first like to address the first question that was raised by Ms. Fernandez, that, what we were exactly discussing? People might test positive using the home test kit and, they're not reporting even if they are absolutely fit and fine. They go out and there is a possibility of them infecting others, which happened with her too and complicated her case.
So, Heena, this answer was already given by Dr. Das Gupta that this is a concern. Right now, we don't have any reporting system. So, reporting system of the self-testing kit, and it is only on the individual who is testing themselves, whether it is positive or negative. The onus is on them only, whether they are isolating it or not, if they are testing positive and having mild symptoms. The concern is here, as the viewer also mentioned, that she's a COPD patient, and now here becomes asymptomatic carrier who has tested positive with the self-testing kit, comes out in the public as he's feeling all right. right, and no reporting had been done by the self-testing kit. No authorities have checked it, whether he is isolating himself or not. And then he comes in contact with the people who are high risk of developing severe COVID and significant disease. So this is a concern, and this itself mentions, and this is a concern itself, showing that we need to have a track system in our track system for this testing of the COVID self-testing kit.
Okay, clearly we need a tracking system. We'll discuss on that bit in just a bit. But Dr. Arjun Dasgupta, will you address the second question that was raised by another viewer, Adil, who said that, is it serious or not serious? Because some try to suggest that, symptoms are just like flu, and hence people also don't know because the symptoms are actually mild.
We are seeing that the whole world is going through the third wave, and we are entered it. I am from South Bengal, and we have already have 35% positivity rate. I will disagree with Adil that nobody in India probably has said that it is as simple as a flu. No, it is not. Omicron is still a coronavirus. It still has got complication. But the whole data that we are getting back from the rest of the world is Omicron is definitely less severe than the Delta variant. It causes less hospitalization. It causes less complication. The vaccination is helping. The vaccination improves the outcome and improves the complication. And actually, there is an Imperial College study which came out. The question he was asking about the second-time coronavirus. The people who are getting infected for the second time, that the first time the infections that get the immunity they are getting from the first coronavirus infection in the first or second wave, if they are getting it in the third wave, it definitely gives them an immunity and protects them against the rate of hospitalization and the rate of complication. So overall, and in fact, I will have to mention you that the picture from the Netherlands Parliament, they have given some scenarios. They have given the worst case scenario and the best case scenario, and at now the what the scenario is actually better than the best case scenario. So the overall news is good, but Omicron is still a coronavirus. It causes complication, so do not take it lightly. And if the whole shift has been from the test, treat, and isolate, now to reduce the hospitalization, I think we should also move in that direction and reduce the hospitalization rate. That is our main concern.
Heena, I'd like to add on this one thing.
It might be less severe. Ma'am, yes, please.
Yeah, so I like to add one thing. This Omicron is very infectious. So earlier in second wave, we called the Delta is infectious 3 to 4 times more than the earlier strain. Now this is 5 to 6 times more infectious than the Delta virus itself. And this is how it is reflecting in the numbers. Now, if the numbers are so huge, as we see more than 20,000 cases reported from Delhi itself in a day. So even if a small percentage of population is getting affected, requiring hospitalization, this number can be actually huge in case of Omicron. So this has to be taken into account. No COVID virus, no coronavirus has to be taken lightly at any end.
So do not take it lightly. I think, Adil, you've got your message. It might be less severe, but you cannot really take it lightly. We have 2 more viewers joining us on the broadcast. Osama Aziz from Lucknow. Good evening. Thank you for calling us here on Mirror Now. What is it that you would like to ask?
Ma'am, and respected to the learned panel, one humble submission is this.
Yes.
That earlier I was told, I got talked to the learned panel, that vaccination just builds up the natural inbuilt immunity. So is vaccination the curity of this Delta variant or this Omicron? Or does it build the inbuilt natural immunity?
Okay. Dr. Bagai, will you like to address this?
This is opening a Pandora's box. This is going to be the largest discussion. But very quickly, I think with regards the mildness of it, let me just refocus on that, because the message to the viewers has to be very strong and very clear. Mild is very relative. Mild for me may be disastrous for the person who I'm sitting next to. Much will depend upon the age, comorbidities, when the second shot was given, requiring the third shot, and so on. Or is the person having built enough immunity? There is a study which has shown that Omicron is 5.5 times more lethal in terms of death rate and mortality than H1N1 influenza. And you have 2.5 times more ICU admission. So it's not as mild as what people think. But on a larger scale, I think there are 4 large studies which have come, 3 from South Africa and 1 yesterday, in fact, from South California, which has shown a dramatic difference between Delta lethality and the Omicron lethality. But that little advantage of it being less lethal is quickly lost because your doubling time is just 1.5 to 1.8 days. So the initial advantage is lost because it's so transmissible. Coming to the vaccine part, I think vaccines are the best and the most strong public health interventional tool. It's a preventive measure. It builds your B cells, which is your humoral immunity. It also builds your T cells, which is your cellular immunity. It is something which is given to prevent infection, to prevent serious infection and death. There is no vaccine in the last 100 years which has ever come into the market for use of human beings, which gives you 100% surety either for symptomatic relief or for asymptomatic relief or to prevent 100% mortality. That's not possible, and it has never been so, and it won't be so. But what these vaccines have shown worldwide, including the mRNA vaccines and both the vaccines in the Indian diaspora, they have an excellent, excellent efficacy. Just to mention a quick word on this, with your permission, Heena, the booster shot, which is now being, which has already been started in a lot of discussion in the medical fraternity and the social fraternity. Your third shot, whether it is heterologous or homologous, that means the same vaccines or a mix and match. There is wonderful data which has come out with regards Covaxin, in which all 3 doses which have been given, it gives you an advantage of 19 to 97-fold increase immunity, including B cells, including T cells, also building up to fight against Delta. I won't know the exact numbers, but the vaccines have worked wonders. As a summary point for vaccines, unvaccinated people are occupying more than 90 to 95% of ICU beds worldwide. Vaccines prevent 9-fold incidence
Even the fatalities that are being reported are actually most among those who were not vaccinated. That's also something that we've raised here prominently many a times. So we have one more, in fact, viewer joining us on the broadcast this evening, patiently waiting. Suketu from Mumbai. Good evening, Suketu. Thank you for calling us here on Mirror Now. What is it that you would like to ask?
Hi, good evening to you and all the panelists. The reason why I wanted to know is about the cocktail shot, which many of the doctors are recommending these days. So I'm concerned about when to take the cocktail shot, or whether should it be taken in the first place, because there is no specific study that tells us whether the efficacy of it, whether it's good or not or whatever. So that was my concern. Yeah.
All right, Suketu, appreciate you joining us here on Mirror Now. Dr. Rajiv Das Gupta, would you like to answer that?
Well, this is something which is under consideration of both the NTAGI and the NECVAC, the 2 national advisory bodies. Currently, India isn't pursuing this track. There are Indian studies too that are being carried out, and the NTAGI and the NECVAC will take appropriate decisions on these, certainly based on the Indian data and evidence from the Indian population.
Okay. In fact, I'm requesting my guest now to please stay on with us, because there's another important update that we want to show to our viewers related to COVID pandemic, the third wave that we are into. Prime Minister Modi held a review meeting on COVID with the chief ministers of all states today. He said that we don't have to panic. Vaccine is the best weapon against variants. He even emphasized the need for preventive, preemptive and proactive approach in fighting COVID. He said we must focus on local containment and we must increase testing in the areas from where more cases are emerging. Listen in.
हमें सतर्क रहना है, सावधान रहना है, लेकिन पैनिक की स्थिति न आए, इसका भी हमें ध्यान रखना ही होगा। हमें ये देखना होगा कि त्योहारों के इस मौसम में लोगों की और प्रशासन की अलर्टनेस कहीं से भी कम न पड़े।
This is what the Prime Minister had to say today. I want to now go back to my guests who continue to be with us to understand more about the kind of symptoms that we are getting to see because of Omicron. Dr. Rajiv Das Gupta, let's begin with you on this aspect. How to differentiate between Omicron, cold or flu, because the symptoms are similar. When is it the right time for somebody to go for a test? Which kind of symptoms should one should trigger a person going for a test?
UK, for example, monitored this, whether these symptoms, which are very similar to common cold as well as Omicron infection, what really is the proportion. So at the height of the Omicron wave or the Omicron-led surge, this was about 50-50. So if you get the symptoms of common cold and so on, about half the chance that you probably have Omicron. And therefore, ICMR in its latest guidelines again reiterated the symptoms that these are cough, fever, sore throat, loss of taste and or smell, breathlessness and other respiratory symptoms. What is distinct is that again another study which reviewed a very large volume of clinical data is that not that these are distinctly different between Omicron and Delta, but that the loss of taste and smell is far more pronounced in Delta. And in addition, another symptom emerging is low back pain. So what the UK advisory is, for example, that the UK that if you have any one of these three key symptoms, a high temperature, a new continuous cough, and loss of sense of taste or smell, then go for testing. Now, in these epidemic times, one goes by what we call the epidemiological diagnosis, that you are on the side of caution, whether you are having COVID, because it has other implications of transmitting to family members or workplaces and so on. And therefore, all the protocols that we see are essentially erring on this side of the caution.
Okay, Dr. Arjun Das Gupta, loss of taste or smell is still a symptom that we need to watch out for, even when it is Omicron?
The loss of taste and smell was more pronounced in the alpha variety when in the first wave. We were getting it somewhat sometimes in the Delta wave, but peculiarly it's being absent in Omicron. So the loss of taste and smell is no longer a symptom of concern. It's more the irritation or the itchiness or the scratching of the throat, that somebody has rubbed your throat inside with a sandpaper, and blocked nose, runny nose, and fever. Of course, the most important is the fever. So typical flu-like symptom, common cold-like symptoms. And if you are worried and if you have fever, you should get tested. That should be the message to everybody. And of course, if you have loss of taste and smell, you still need to get tested.
Okay. Dr. Bagai, I want to understand from you about a study, in fact, that has come, which has shown that coronavirus has become 90% less infectious within 20 minutes of becoming airborne, losing most of its ability to infect after the first 5 minutes. What will you say about this new study that has now emerged?
I wrote on this. So this. So let's talk about first SARS-CoV-2. SARS-CoV-2 captured our imagination not so much in the alpha or the beta or the gamma. It actually swept the carpet underneath our feet during the delta. So this is a microaerosol. It can be less than 1 micrometer, which is subatomic level. It's a lipid-covered particle. It can travel in the air. Your exposure now for Omicron is supposed to be less than 3 to 5 seconds to infect. It can travel up to 60 feet. In closed environments and poorly ventilated, it can travel up to 800 feet. Last year, we were talking in a beautiful article in Lancet, which was written as long COVID. It is truly airborne. This time, it is fly COVID. It can go from corridor to corridor, from floor to floor without a person leaving the room. So obviously, it is hugely transmissible. Now, with regards this particular article which you're mentioning, I wrote about it 3 days back. This study has limitations. This study has limitations on a biophysical level. Yes, we know that once the viron leaves the oral cavity or the nasal passage in speaking or coughing or singing or sneezing, it shrinks in size because it loses the shape, it loses, it's called as crystallization. And the larger particles fall a little closer, the smaller particles, depending upon the velocity in which you speak, can travel much longer. The smaller particles can travel much longer. There is an interplay between relative humidity, temperature, and lateral flow of air in the room. So if your relative humidity goes up, then your percentage of transmission goes down. If your temperature goes up in the room, it impacts the transmission. So this study has limitation. The carry home message is very clearly, in fact, the study has been slandered on Twitter. But to come to the crux, this is an airborne disease. We treat this disease with respect. Even a small few seconds exposure is sufficient to infect you. Don't take a risk. Mask is not fashion statement. It is not below the chin. It has to cover your nose and mouth, well fitting.
Okay, moving ahead, there is another important aspect that I want to highlight for our viewers, and this is about the rising number of fatalities. Dr. Ankita, let's begin with you. In the last 24 hours, 380 people have lost their lives due to COVID versus 165 deaths that were reported on Monday. What is your opinion, your assessment of how the number of deaths have been increasing on a daily basis? While we continue to say that it's milder, Omicron is causing a milder disease, but are you concerned about rise in fatalities?
So, Heena, as I have mentioned that though Omicron is technically everybody is saying it is mild, but it actually being a lot of infectivity is very high for this virus, and if it is affecting a patients who are having comorbidity illness, in that case there are chances that they get into a severe disease. Now, if we see the rising number of deaths from here, we have to understand once the patient gets the COVID infection, it is not just that after diagnosing with the COVID, the patient gets sick. They get ill as the time passes away, maybe in this next week, second week. So this is what the data are also reflecting. Once the hospitalization is there, they are getting sick. Oxygen requirement is there, maybe in ICU, on ventilators, and then the death toll start rising. So as earlier also in many debates I have mentioned that just labeling Omicron as a milder version, as comparing it with flu, will not help us. We need to understand it is too early to comment on this, that the fatalities will not be there. Being so infectious, this virus can, if affecting the patients with comorbidities, the elderlies, the death toll can rise and the hospitalization can increase.
Okay. I'll seek the view of my other guests as well on this rise in the number of fatalities. But before that, we have another viewer joining us on the broadcast too, Srinivas from Chennai. Good evening, Srinivas. Thank you for calling us here on Mirror Now. What is it that you would like to ask?
Yeah, hi, good evening. My question is actually something bizarre which happened a couple of days ago. A friend's doctor had symptoms in Chennai. Now, she and her husband tested, and they tested in two labs, two very reputed labs, NGM and Newburgh in Chennai. And surprisingly, the two labs reported diametrically opposite results for both of them. One gave a positive, and the other gave negative for both. And they just didn't have a clue. I'm talking of doctors, and a doctor and a husband. They didn't have a clue as to what could be the problem. So having symptoms, but getting exactly opposite results from two very well-known labs here. Is there any answer or explanation for why this could have happened?
Okay, Srinivas, appreciate you joining us here on Mirror Now. We'll get this answered from our guest. We have another viewer joining us, Sandeep from Goa. Good evening, Sandeep. Thanks for calling us here on Mirror Now. What is it that you would like to ask?
I want to ask a basic question. See, doctors are saying get vaccinated, get vaccinated. I'm 63 years old. I have not got vaccinated ever. And I do not have COVID. My wife has got 2 open heart surgeries. I had kind of a stroke. I drew to the hospital, which is called Manipal. The doctor said, okay, you have a stroke, but I was normal. I had a little bit of problem in my speech. I was like, it was a slur. Now, getting vaccinated, bottom line, what I understand, I lived in America for 35 years. I'm 63 years today. You get vaccinated, there's 1 vaccine, 2 vaccines, 3 vaccines, and it goes on and on and on. It may be 6 vaccines, which I've heard today in the US. So I really want to ask the doctors, do they know what they're saying? Do they really know what they're doing? Because I have not got COVID, my wife doesn't have COVID, and we are living normal. So I'm not, I'm not generalizing the whole thing. Maybe for people it's good, I don't mind. But just don't tell us to get vaccinated. Supposing I get vaccinated tomorrow, and then I take the second, and the booster, and if there's a new, whatever variant or whatever, I mean, I'm really confused. Because even the doctors don't know what they're saying.
Okay.
Bottom line. Okay.
Okay. Well, Sandeep, I appreciate you calling us here on Mirror Now, and we wish you good health. It's good to know that you are absolutely fine, even without taking the vaccine. But clearly, vaccine is the only shield that's available to us, apart from the mask, to help us fight this COVID pandemic. And the doctors are actually our COVID warriors who've been working non-stop to ensure that we all remain safe. Dr. Ankita, will you like to address the concern that Mr. Sandeep first raised from Goa? Then I'll talk about Mr. Srinivas's question later.
Yeah, so as Mr. Sandeep has asked, that there was 2 discordant report. So first thing, the sensitivity of even RT-PCR is not 100%.
No, that was
so
Mr. Srinivas from Goa.
Yeah, so it is not 100% even for RT-PCR. So that we need to understand. Also, the sampling technique is also very important. So these viruses, they reside in the cells. So if the sample is not taken properly, it's majorly the secretions only, like saliva or nasal secretion, and not containing the cell, then it might happen that the RT-PCR is going to miss it. So sampling technique, that is important. And if I talk about sensitivity, even RT-PCR is somewhere around 70 to 80%. It's not 100%. So even if a patient is symptomatic and the test, even if they tested from 2 different labs and one is testing positive, it should be taken as the patient is positive for COVID virus. Yeah. And the next question.
Okay. Dr. Rajiv Das Gupta.
No,
yes.
I fully agree with her explanation. As far as the larger vaccination strategy is concerned, the global consensus certainly is that vaccination protects against severe outcomes of the disease, including hospitalization and death. And that's the goal all across the world, including in our country. The booster, therefore, in its own wisdom, the national advisory bodies have been pretty conservative about the boosters, not really agreeing to it till early this year. First, as we know, approving it for health and frontline workers and those above 60. But there's a catch here that in the Omicron context, again, very large-scale data from South Africa actually shows that the incidence rate or the risk by age group categories is pretty much the similar above 30, 35 to 60 and above. Now, if the boosters are to offer additional protection in Omicron, even those with in the lower age groups, among the adults, that is, but with comorbidities, can certainly carry a risk. And therefore, currently, while it is limited to those above 60, but there may be a room for expanding it also, particularly for those with comorbidities.
Okay. Dr. Arjun, now coming back to the point that we were discussing earlier about the rise in fatalities Any indication that you're getting that suggests that this mild Omicron as well can cause a surge in fatalities, maybe in unvaccinated people or in people with comorbidities? Is that the reason why we have seen this spike?
Definitely, Omicron is not a simple chickenpox or a simple flu. Omicron is a coronavirus. It is infective and it causes problem. Now, as the South California study that was mentioned in here has shown that the Delta to be having a complication rate of 1.6, whereas Omicron is 0.5, but it's still significant. The number of people affected is just a tsunami with the Omicron cases that will surge throughout the country. And in a time frame, and one patient affects about 1,000 Delta, from one patient, about 1,000 Delta patients get infected. In the same time frame, Omicron will infect around 1 million. So the number of people who are having complication, needs hospitalization, and with the morbidity and with comorbidities, oxygen requirement is going to be huge. So that is going to put a pressure on our health system, both private and government, to oxygen beds and so. Till now, the data that is coming out for the rest of the world, where there is a third wave going on, is good, that the number of people who need hospitalization, oxygen beds, ventilators are definitely less, but none of the less is definitely not normal. So we are not going back to normal as yet. We have to stand on guard. Right now, the strategy should be to prevent hospitalization for this patient, and that should be our main, and increase the hospital and oxygen beds as such. That should be our main focus right now.
Okay. Okay, we have another viewer now joining us on the broadcast, Suhas from Pune. Good evening. Thank you for calling us here on Mirror Now. What is it that you would like to ask? What is your concern?
My name is Suhas Mauskar. I am 71 years old.
Okay, we have another viewer now joining us on the broadcast, Suhas from Pune. Good evening. Thank you for calling us. Good evening. Could you just put your television on mute?
Mute. 1 second. Yeah, I'll do that. Yeah, I did. I am 71 years old.
Yeah.
Last year, in the month of March, April, I have taken the shots in USA. I have taken Moderna. My wife has taken Pfizer. But after coming here, I am inquiring at every vaccination center, but nobody is clear as to what I should take as a booster dose. Thank you.
Okay. Suhas, appreciate you joining us here on Mirror Now. Dr. Rajiv Dasgupta, will you like to respond to it? As of now, I don't think there is any provision for people who've taken Pfizer shot, or is there one?
No, actually, the CoWIN app does not have a provision for this kind of a scenario where the person has received the primary schedule elsewhere with a different vaccine and now needs to be registered. So he will be registered just like a first dose. And the first dose, in his case, will act as a booster, as a mix and match scenario. Now, this is somewhat out of the algorithm in the country, but I'm sure there would be many such individuals with a very large number of diaspora population all across the world.
Well, absolutely. It's a new question that we also got. Definitely, the government should consider making some provision for people who went out of the country and got their first dose, which is not available, at least here in India. There should be some provision for them as well to be able to get the booster dose if they are in the eligible age group. I appreciate all of you for joining us here on Urban Debate this evening. Thank you very much. And thank you for answering the questions of our viewers as well. And with this, we will slip into a very short break on Mirror Now.